So welcome to this second of our lectures in our evidence-based practice series. This will be the first one using the von Lunen book. As you can see there, so the PowerPoints will be basically the same, with these orange ones being the von Lunen book and the other ones being the Rob book. So we'll start with chapter 1 and go from there. So our key objectives and points for this lesson is understanding how to write this clinical question. We started down that process in the previous lecture, but with this one we're going to dig into it a little bit more deeply. Also with that, in that in-depth look, we'll evaluate some different formats that we can use for developing our clinically relevant question. And then finally, understanding how these clinical questions can assist in finding the best possible evidence. So before we begin into the clinical question, we need to start a little bit in the understanding of the overall questioning process within sports medicine and athletic training. Really, it comes down to two different broad groups of questions. The first one can be most categorically described as a background question, and that's simply our normal questioning process. In a background question, the purpose is to try to create the framework for understanding, meaning that basically in a background question, we're just throwing out our ideas and trying to figure out how best we could go about answering those. And so the example here of what treatment approach will be most effective for someone with patellofemoral pain. What makes this a background question is it really doesn't lead to specific answers or specific ideas. It just creates the background now for what we would be trying to figure out. And so background questions start with the purpose of creating that framework, and if all you have the knowledge for is a background question, then really what you need is background information. And so in this case, if we're just looking for basic treatment approaches and we're not really sure what our options are, we might just start searching for literature on patellofemoral pain interventions and trying to figure out what exactly are our possible options. We then need to transition into what we consider a foreground question, or basically a question that is both searchable and answerable in a specific way. Whereas the background question is going to lead us to probably more questions than answers as we figure out what sort of possibilities there are out there for patellofemoral pain treatment. A foreground question now leads to a specific answer that can lead to a specific intervention or a treatment plan. And so you can see how we took the background question of what treatment approach will be most effective for someone with patellofemoral pain and transformed it into a foreground question, specifically looking now at the differences between orthoses and taping. And so we created now a foreground question where we have specific enough information to lead to the answer that we're looking for our particular case. And so you can see how from the background question of what treatment approach would be most effective, there could be dozens of foreground questions, but by transforming it from a background question to a foreground question, we now are creating a closer approach to what we are specifically looking at, which is how can we best treat the individual in front of us, opposed to simply everyone with patellofemoral pain. And so we talked a little bit last time about the Pico format, and the von Lunen group added this intervention of, or this component of T for time in a time component. So we'll go through all of these again just because it becomes important as we look through these. But I'll remind you that the P is our patient population or our disease of interest. The intervention or issue of interest represents the I. The C is the comparison group with O being outcome, and then T being added for time component, understanding that based on when we are in the treatment program or what availabilities we have for time might change our overall outlook on what information is most important. If we are looking at somebody that now, in our previous question, has had patellofemoral pain for an extended period of time, that would be very different than somebody that has an acute onset of patellofemoral pain. Also, the time can be how long the intervention needs to be worn. And so by adding time, you create a way to more specifically address your overall question and needs. So we'll stay on this for a little bit when we also look at that not every single one of these needs to be addressed in every single clinical question. And that's where the PIO, PICO, PIOT, all right, all these different acronyms come into place. They're the same components. However, not all clinically relevant questions need each one of these. It may be, excuse me, it may be that our comparison isn't really needed because our comparison might simply be either no treatment or just a standard-based treatment. So the idea would be if we are trying to add, say, ultrasound to a treatment program, we really don't need a true comparison group because we're looking at the addition of ultrasound compared to probably nothing. And so you could consider in that case the comparison group to be nothing, but in that case, what does that really add? Also, you might not need the time component. We talked about that as well. And so that's where those different acronyms come into play. There's really not anything special about choosing one over the other, but based on what our individual needs are. And that leads us to the different types of clinically relevant questions. And so we'll explore how we can use these then to create our questions. But first we need to understand, first and foremost, what different types are and how that's going to lead us to slightly different answers. And so the first type of a clinical question is an intervention or therapy question. And this is usually what we're thinking of most often, because most of the time when you get into evidence-based practice components, you're trying to figure out what is our best intervention plan for our particular patient. And so questions like this stem from the idea of does the use of ultrasound increase healing? Does it lead to increases in range of motion? All those different ideas of does a therapy work are all examples of intervention or therapy questions. But that's just one of the different types. An etiology question now focuses on the causes of conditions. So sometimes we're looking for either prevention strategies that we can implement, or we're looking for people that are at higher risk associated for a individual condition. And so etiology questions then allow us to look for those underlying causal factors that might be present within our patients that we could possibly address and either prevent the condition or try to lessen its likelihood of occurring. So things like when you look at biomechanical analyses and the potential for injuries, or things, like excessive Q angles, different components like that, those focus now on an etiology question where we're trying to figure out whether or not those are associated with specific conditions and how we might go about trying to then minimize those would then become a therapy or intervention question. Diagnosis or diagnostic framed questions focus on the efficacy of our diagnostic tools, understanding that when we learn evaluation, we learn a whole bunch of different ways to go about evaluating different conditions. And it makes sense that some of these evaluation tools that we have, some special tests, are better at predicting certain conditions over others. That's why they are associated with those different conditions. But when we have more than one diagnostic test that's associated with a specific condition, it is quite possible that we might have contradictory results from each of the tests, and then we need to figure out which of these tests is best for identifying that individual condition within our patient population. And so we can create diagnosis or diagnostic frame questions for that purpose as well. Prognosis or prediction questions focus on the idea that we need to be aware of possible complications or just the clinical course over time. And so we might be trying to figure out what a basic return to play program looks like for an individual patient. We might be looking at the possibility of other complications that might come up. So using a good example for that, we might need to understand the basic healing of an ACL repaired patient, and understanding the ACLs going through a revascularization and transformation phase throughout their rehabilitation program. And because of that, there are times, in fact, when the ACL is at a weaker point than it was immediately post-surgical. And so understanding that healing time frame, as well as the potential complications associated with the possible surgical intervention, like with patellar tendon graft patients having the increased possibility for patellar tendinitis, would help us in our determination of the appropriate course of treatment for that individual. And so these come into, sorry, my light turned off. Those come into play then in this idea of prognosis or prediction questions. The last type of question is more unique, and these are meaning phrased questions. And a meaning phrased question is really when we're trying to understand either experiences or perceptions of groups. It's possible that we're trying to treat patients, and in our need to understand the patient values as well as those patient experience, we can go through and use literature and evidence to help us in that situation as well. And so maybe we're trying to figure out what potential psychological issues might be happening with our return to play participants in that ACL case, or different aspects like that. And so those are meaning phrased questions, and usually these have survey-based research associated with them. So once we've identified which type of question, and there are the definitions as well listed there, we can then use the template that is at the right of our screen there to take basically our PICO question or a PICOT question, PIO question, whichever one goes is most appropriate, and basically just fill in the blanks to create it into a sentence. Not that the overall sentence is important. Really, the important component is the different components of the acronyms, the P, the I, the C, the O, and the T. But creating a question gives us an overall framework for then going about our next steps in the evidence-based practice. And so you have those templates listed there, and you can use those when doing assignments or just in discussions with individuals as well. Or you'll often see in the literature the authors will describe their own clinical question that they were investigating as part of their research there, and it'd be in this sentence format using one of these templates. So in review of our basic key points and objectives for the day, understanding first and foremost that this clinical question form creates the foundation in the evidence-based process, and therefore is the first step. We have to have a good clinically relevant question that is answerable. Otherwise, we won't be able to start down the correct transition. And so that is moving from those background questions to those foreground questions. So that way we have something that we can research and work towards answering. We talked about the different components associated with clinical questions, right? The patient population, the intervention, the outcome, comparison, and time frame, and how each of those can be used depending on the information that you're seeking. But not all of them need to be a part of each clinical question, or just may not have the same amount of importance within our question. So what often occurs is you'll create a full PICO type question, but when we get to searching, which is the next step in evidence-based practice, we're going to rank order those in what is most important. And so that's where often the different components start to fall off, is once we get to a situation where we don't necessarily have a comparison group, or the comparison group isn't as relevant with what we're doing, or the time frame might not be as relevant as what we're doing. We can eliminate that from the question basically within the search process by eliminating our need to search or evaluate or eliminate research based on that. And then understanding that the purpose of these clinical questions is to assist in finding that best possible evidence for your particular practice and the case that you're dealing with. And so each time these clinically relevant questions come up, they're going to be slightly different based on the patient population or the condition that you're doing. And so this is where you basically can create a unlimited number of clinically relevant questions that are most relevant to you, but you need to go through this overall format so that way we get into a situation where we can go about creating the question, but more importantly, finding the answer.